Italy, America, virus, and liberty. I want to start with just a little chart I sent to Matt the Wonderful. It's got pink, which is a nice color for you to be able to see it well, but it has a pink chart and it's just showing the difference between the numbers of cases we have in America and the numbers of cases which we had with the swine flu in previous years. And so Matt the Wonderful, if you can put that data up. Okay, so you see the big, tall, pink line. There's big, tall, pink line. Big, tall, pink line on the left is the average number of people who die of the flu every year. Average number, and this is obviously less, a little under, it's more than 400,000, a little under 500,000 average global flu deaths. And that's fatalities in 2017, 2018. The U.S. flu and deaths. So the next smaller little pink thing is the U.S. flu in 2017 to 2018 deaths under 125,000. In fact, it's well under the halfway mark. So that big pink is number of people die of flu every year. 27 to 2018. Average number of flu deaths under 500,000, but getting close. In America, well under 125,000, 2017, 2018. Okay, the next little thing over where you can see there's nothing, there's actually a tiny little pink thing. That is the number of U.S. deaths from the COVID virus, 2019, 2020. There's nothing there. Right now, the fatalities from COVID-19, the disease caused by coronavirus, COVID-19 is so tiny in terms of how big there should be a pink mark there. There's nothing there. The next thing over, that tiny little pink, is global COVID-19 deaths in 2019 and 2020. I'm just pointing out that we have many more deaths from the flu, the pink big column versus on the left and the far right, many more deaths annually from the flu than we've had yet so far from the coronavirus. And I'm planting that seed of thought. I will get back with you with more data on Thursday and probably other shows going forward. But it's important to understand that the flu, sadly, claims people's lives every year. Mainly older people, often people who've had some kind of compromised immune system or some other health problem. I am not saying that their deaths don't matter. Everyone's life matters. Everyone's death matters. I don't wish illness or death on anyone. But it's really important to understand, just keep that chart in mind, as I mentioned a couple different things about the way America is reacting. We're going to go more into this later in the week, but the way America is reacting to this seems like if you'd had that data, and you can see how we're reacting right now, you might question why we don't react that way during every flu season. Why, during every flu season, don't we shut down everything in America? Why do we tend to act more like the advice Dr. Fauci was giving in 2009 when we had actual swine flu deaths, thousands of them? He's saying, hey, if you don't feel well, stay home. There is and I don't mean to diminish people. I don't want a virus killing anybody. I don't want the coronavirus anywhere. But it's really important to understand we're starting to surrender a lot of liberty in this country over something that has not so far exhibited the level of danger to America that the average flu season does. Not even close. This gets back to the point I was making about the charts and how, the predictions and the graphs and, if this much happens, then these things happen. And look at these big numbers over here with the graphs. So the graphs matter, the data matter. During this week, I will tell you, there are going to be many more flu tests administered. And because more flu tests, I'm talking about coronavirus, more coronavirus test kits will be available, more tests will be taken, more numbers will show of the coronavirus increasing in numbers because more tests are being done. The fact that more tests are being done does not necessarily mean that the coronavirus is spreading faster. It means more people are getting diagnosed. Look, I don't want people to be ill. I want people who need to be tested. I want people to be compliant. I want people, to use social distancing, to practice the kinds of things we're being told to do to diminish the spread. But we are starting to surrender liberties in this country, such as orders by the government to shut down private businesses. It is different to shut down public schools that are publicly funded, the government's money, shut down private businesses, and differences between making a suggestion of wisdom about businesses versus ordering them. This is a new level of governmental authority we need to be very alert to in our country. And I want to just very alert to the potential harm to liberty. I want to one more thing about Italy, and because Italy is obviously having a really, really hard problem. And I love Italy, to be clear. I've been there several times. I love Italy. I love the food. I love the art. I love the feel. I love the old streets. Italy also has a much older population than America, average age older. Italy's having a terrible time. Italy has a much older population. Italy has a higher percentage of people who smoke cigarettes. Italy also has a massive infection, in part because of the growing connection over the last several decades between Italy and China, when China and its Belt and Road Initiative is using its money to, their claim to help and spread the connectivity of the world. But literally in northern Italy, Italy had about 300,000 people from China living there, going back and forth to China. I care about everyone. I don't want anyone to suffer. But we don't have to look at Italy and assume that will happen in America. Italy also had, talking about contrary to the normal suggestions that would be made in terms of how you keep people safe, Italy also had the mayor of Florence early on when the Wuhan virus, then being called Wuhan virus, was being talked about. Italy had one of its key cities' mayors in an attempt to fight back against what he was viewing as, xenophobic or, mean to Chinese people. He had a little saying. He was out there, hey, don't be afraid. Hug a Chinese person. Hug a Chinese person. So Italy's got problems. I want everyone in Italy I want them to have enough masks and ventilators and supplies. I hope America can kick up production to the point we can be exporting test kits and ventilators and masks. We can handle this. But we don't have to look at Italy and assume without question that everything wrong happening in Italy will most definitely happen here. We can love Italy, love the Italian people, want them to be healthy, and recognize there are differences between the Italian society and culture and the American society and culture. America is being responsive in very positive ways. We need to be proud of our country's response. We have to be engaging and helping in our response, while keeping in mind about whether we need to be questioning the beginning, the shutting down of liberty in this country, I think is a huge problem. But we need to not panic in this country about coronavirus, follow the instructions about social distancing and hand washing, all that stuff, take care of ourselves, but have more faith in the American people, the culture, the economy, the freedom, the self-reliance, all the elements that make America great. Those elements are going to help us get through this coronavirus. We can even be helping the countries of Italy and other places where the problem is extreme, but we don't have to give in to the panic and the fear the left is working so hard to instill in our culture. We have to reject the panic and fear and embrace and love how well America is responding to this crisis.